Co-Chair Winters, Co-Chair Williamson, and members of the Public Safety Subcommittee. For the record, my name is Michael Mson. I'm appearing before you today on behalf of the Native American Rehabilitation Association of the Northwest, which has several facilities in the Portland metro area, including the Urban Indian Clinic that's largely federally funded under the Indian Health Care Improvement Act. At the clinic and at the residential treatment facility that NARA runs, there have been a steady increase in domestic violence related injuries in the last several years. You're hearing about the numbers going up. They're also going up, and they were high enough already among Native populations. Funding is desperately needed to protect children and adult victims. Tribes, of course, are working on funding on the federal side, been lobbying heavily for passage of VAWA, which we are praying for passage tomorrow, or at least very, very soon, passage of the VAWA reauthorization. But a recent U.S. Department of Justice study reveals that approximately 1/3 of women and girls will be attacked in their lifetimes, which is a horrendous figure. This becomes even more staggering when you add the men and boys who are victimized. However, as you're probably aware, most of the First Oregonians even, and of course Native people in Oregon, don't live in Indian country. They live in urban areas, primarily in the Portland metro area. So funding that we're talking about today for ODSVS is literally life-saving, and NARA urges the Public Safety Committee to recommend to the full Ways and Means Committee an addition of $4 million to the governor's recommended budget in this area, and I'd be happy to answer questions. Thank you again for your time on this very important issue.